Minister, I saw the Taoiseach on prime time having fun at Sinn Féin's expense and referring to them as, what was it? Spin Féin. Spin Féin. And I thought, to be honest, that was ironic listening to him, and I thought it was even more ironic when I listened to you and Stephen Donnelly today, when I think, frankly, the performances by the Taoiseach on prime time, yours today and Stephen Donnelly's, suggest that it's more about spin a gale and spin a fall. And I mean that in all sincerity, because you see, you take your speech, there's almost nothing I could disagree with. It was a great speech, heaping praise on our health workers. We must never go back. Absolutely, we must never go. Brilliant, absolutely brilliant. I don't know if you wrote it or it was a speechwriter, but I couldn't agree more. But then the truth is revealed when Stephen Donnelly gets up. And it's very clear that the party with whom you've just agreed a deal and the deal itself make a clear and explicit commitment to go back. Not to go forward, but to go back. And that commitment is to reopen private healthcare and to source the additional capacity that we now need more than ever. We needed badly before COVID, and we now need even more badly. More capacity is required, but it's going to be sourced through a deal, the NTPF, right, where we're going to rent it off the profiteers in the private healthcare sector, rather than move immediately forward, not back, as you suggested you wanted to do, to a national health system, to a single-tier, universal national healthcare system. So we can have all the aspiration towards Sláinte Care, 10 years, accelerate, I think was the phrase, but in actuality, the plan is to immediately move back to the two-tier system and to source additional capacity by renting it at extortionate cost from Larry Goodman and Dennis O'Brien and all the people who make a fortune out of this stuff. And there is the spin. Okay, there is the spin. And the heaping of praise, isn't it the case that the heaping of praise on healthcare workers in the same context rings deeply hollow? In fact, is hypocritical. Because, you see, what is capacity in the Irish Health Service? I mean, before COVID, we were running at 100% capacity. In the case of ICU capacity, we were 50% below what we needed to be, and now we need even more. But in the general system, we need at least 20%, and then with social distancing, we need more than that, permanent capacity. Not rented from the private sector, permanent capacity. If we're going to have a single-tier health system, and in the ICU, we need more. Now, what is that capacity? It's the staff. It's not the beds, because we actually can get the beds pretty quickly, right? It's the staff. And how have we treated the staff, Minister? How are we treating the staff? Well, we know 70,000 people who you lauded, heaped praise on, and who deserve to be praised, volunteered to come back and work in the health service, and you just won't recruit them. And the Taoiseach says on prime time to national television, says anybody who wants to work in the health service, we'll hire them if there is, and this is the spin, if there's a post. Brilliant. If there's a post. But of course, the number of approved posts is nowhere near what's necessary to give us the additional permanent capacity, because you won't approve the posts. Right? Isn't that the truth? So instead, we recruit people on agency contracts, hire them and fire them contracts, and we can throw them back out. And by the way, the fourth-year student nurses, they can be thrown back out as healthcare assistants and so on. There's no real commitment to the permanent increases in capacity. I'll give him 20 seconds to answer that. But
into your party title, but you gave it a very good go there. I get a little bit upset though, genuinely, when somebody suggests anyone is being hypocritical praising staff. No political grouping owns them. They're all our families, friends, communities, constituents, and we're all very grateful for what they do. It is possible, Deputy Boyd Barrett, to create a universal healthcare system like the NHS and still live in a country where there is private healthcare. And that's what we're trying to do in this country. Not ban private healthcare, but create a universal healthcare system. I'm committed to it. I signed up to Sláintecare. Don't know if you guys did, and I don't mean that smartly. We've signed up to Sláintecare, and if you look at the programme for government, or the draft programme for government, hiring public-only hospital consultants, hiring 1,000 of them who can only carry out public work, paying them a decent salary but only public work. That's how you create a public health service system. Statutory home care scheme, that's how you create one. The elective hospitals to drive down waiting lists. We're going to deliver Sláintecare, and we are going to accelerate it, but I guess we'll get to debate that on another time. We are going to hire significant additional staff, and you will have heard Paul Reid's comments today about broadening the number of training schemes. So, and I did say we do have a once-in-a-generation chance to keep these people here in Ireland.